Renin Angiotensin system, a system which is responsible for regulation and the effect on hypertension in hypertensive patients. The hypertension can cause congestive heart failure because the pressure of the blood on the heart, myocardial infarction, diabetic nephropathy, nephropathy. In 1998, a scientist called Berman found that crude saline extract of the kidney contained a precursor substance they called tretinoin. This scientist has discovered that there is a saline produced by the kidney. This saline has a vasopressor effect. Furthermore, they discovered that this substance, which is renin, is an enzyme which acts on plasma protein substrate to form angiotensin. The angiotensin is the primary material of angiotensin 1, which is further converted to angiotensin 2, which has a mechanism to cause hypertension. In 1950, two forms of angiotensin are discovered, angiotensin 1 and angiotensin 2, and they discovered that there is a the angiotensin 1 is polypeptide and angiotensin 2 is polypeptide, but there is a cleavage in the peptide of angiotensin 1 to is transformed to angiotensin 2. This cleavage is accomplished by angiotensin converting enzyme, which is the ACE. The angiotensin 2 promotes the sodium and water retention in the blood vessels and cause hypertension. What about if angiotensin? If the patient has a angiotensin promoted hypertension, which means that the hypertension is caused by angiotensin, is it effective to administer spironolactone to decrease the aldosterone in this patient? We will see in the research that there is a hypertension called TGR, which is the angiotensin promoted hypertension, which is a genetic cause of hypertension. We triggered hypertension rate by the administration of aryl hydrocarbon called indole-3-carbinol or IC3. This IC3 imitate the TGR-based hypertension, which is in human, and the dose of IC3C indole-3-carbinol controls the severity of hypertension. How accomplished by I3C, the genetic cause of hypertension in human, but in rate. The genetic effect of IC3 mechanism to produce the transformation of genes called CYP1A1Rene2 make Rene2C DNA expression. There is the IC3 promotes by genetic transformation the expression of Rene2C DNA, which increase the circulating renin level, increase renin angiotensin aldosterone system. This transformation has an effect on sodium excretion. there is three mechanisms of sodium reabsorption, which is the return of sodium in the body. The first one is the aldosterone sensitive distal nephron, sodium chloride co-transporter NCC, the epithelial sodium channel ENAC, which promotes the majority of sodium reabsorption and is returned to the blood. What is the effect of the genetic transformation by I3C? There is an increase of sodium channel co-transporter NCC. There is an increase of thiazide sensitive reabsorption, slight increase in the amyloid sensitive reabsorption pathway. There is an increase in epithelial sodium channel ENAC. Thiazide sensitive transporter. The reabsorption of sodium in the intestine is mainly accomplished by thiazide sensitive transport. Thiazide sensitive transport is responsible of 5% of total sodium reabsorption of the vertebrate sodium load. And this pathway of course increases during the transgene induction. The mechanism of the diuretic hydrochlorothiazide is to block this mechanism to promote excretion of sodium. What is the effect of the genetic transformation on myocardial vascular injury rate? Myocyte vasculation, vasospasm, kidney, and even some myocyte cell death, and even vascular damage and destructive vascular injury, plus necrosis in smaller intertubular arteries and afferent artery. And this was part 1. We continue in part 2, the effect of low sertraline and spironolactone in this kind of hypertension. Thank you.